This presentation is about the symptoms of PTSD. It is also part of the prolonged exposure therapy treatment program and is part of session 2. The presentation is intended to provide you with information from the prolonged exposure therapy for PTSD program. However, the prolonged exposure program itself is intended to be interactive. So in order to achieve the desired results, please have a way to take notes while listening to this presentation. You'll know you need to write down some notes when you see this image. Please bring your notes into your next session with your therapist, and that way some part of the interactive nature of this can be retained. What are common reactions to trauma? Well, a trauma is an emotional shock, and the main reactions after trauma are fear and anxiety. So, take a moment and answer the question, are you feeling fear and anxiety? The fear may be linked to reminders of the trauma, or it may feel as though it comes out of the blue. Do you notice that there are certain times and situations associated with fear and anxiety for you? Take a moment, write down your answers and thoughts. Feel free to pause the presentation if you need a little bit more time. Fear and anxiety reactions. The feelings you experience are reactions to a dangerous or life-threatening situation. You may experience changes in your body, your feelings, and your thoughts because your view of the world and your safety was changed because of what happened. Certain triggers and cues may remind you of the trauma and activate those fears. These triggers could be times of day, maybe a particular place, activity, a stranger approaching you, certain smell or noise. So take a moment and answer the question, have you noticed specific triggers that remind you of the traumatic events? And again, please feel free to pause the presentation in order to have enough time to answer the question. Commonly, fear and anxiety are experienced in a couple of ways. You may re-experience aspects of the events. You may feel jumpy, jittery, or wired. So take a moment and answer the question, have you had any of these experiences of re-experiencing or feeling jumpy, jittery, or wired? People who've had a trauma may have flashbacks to the memories of what happened. Visual pictures of the events may suddenly pop into your mind. Take a moment and answer a couple of questions. Are you having flashbacks now? And what is that experience like for you? A flashback can seem so real that you feel as if you're having the experience all over again. You may feel as though you don't have any control over what's happening to you. And sometimes flashbacks are triggered by events, but often they seem to come out of nowhere. You may have reminders of the events in the form of nightmares. And take a moment and answer the question, have you been having any nightmares since the event? Again, feel free to pause the presentation to have enough time to answer the question properly. And what changes do you notice in your body when you do have nightmares, if you have them? You may also have distressing thoughts or feelings about the events that aren't flashbacks or nightmares. So take a moment and answer the question, have you had any of these experiences, meaning distressing thoughts or feelings that are neither flashbacks nor nightmares? Many people find that they have trouble concentrating after a traumatic event. So answer the question, are you having any trouble reading, following a conversation, or remembering something that someone told you? Feel free to pause to answer the question properly. It's frustrating to have trouble concentrating, remembering, or focusing on what's going on. This experience can lead you to feel you're not in control of your mind or even that you're going crazy. Difficulty concentrating can be due to thoughts that intrude into your mind related to the memories of what happened, but at other times there may seem to be no association to the trauma. Other common reactions are feeling hyper, agitated, jittery, trembly, easily startled. Feeling tense and jumpy can lead to feeling irritable, especially if you aren't sleeping well. Take a moment and answer the question, have you noticed your body experiencing any of these changes? Are there times when you feel panic? What happens to your body? Do you sweat? Does your heart race? Are you easily startled? Feel free to pause to answer the question properly. You might also find that you're avoiding people, places, or things that remind you of what happened. Avoidance is a way of protecting yourself from situations that seem dangerous or from dealing with thoughts and feelings that might seem as if they'd be overwhelming. Take a moment, answer the question, do you find you can't go certain places or do certain things as a result of the trauma? Have you been trying to avoid thoughts or feelings associated with the events? And what kinds of things do you forget? Sometimes people want to avoid memories and feelings so much that they find they've forgotten important details about the events. Are there any parts of the trauma that you can't remember or gaps of time that you can't account for? Another way that people try to deal with overwhelming feelings is emotional numbness. Take a moment and answer the question, do you have the experience of feeling numb, empty, or detached from what's going on around you? And feel free to pause the recording to have enough time. And take another moment to answer the question, have you lost interest in things that are going on around you? Finally, do you feel detached from people since the trauma? And you'll probably need to pause the recording at this point to answer all of these questions. Other common reactions to trauma are sadness and a sense of feeling down or depressed. You may have been feeling hopelessness or despair, crying, feelings of hurting yourself and suicide. You may feel a sense of grief for what you've lost or for who you were before the trauma. And it's also common to feel a loss of interest in people or activities that once were fun. You may even feel that life is not worth living and that plans you made for the future may no longer seem important. So take a moment and answer the question, have you been feeling sad or depressed at all? And please pause the recording to have enough time to answer the question properly. Are you often fearful? Are you feeling stuck or hopeless? Are you having any feelings or ideas that life is not worth living or that you would be better off dead? And surely with all of these questions, you're going to have to pause in order to answer properly. So do that right now, and then write down your answer and come back for the rest of the presentation. During the trauma, you felt threatened. You may have felt you had no control over your feelings, your body, or your life. Sometimes these feelings are so intense that you may feel you might be going crazy or losing it. Have you had this experience since the trauma? And what was it like? Often people have feelings of guilt or shame. These feelings may be connected to something you did or didn't do to survive the events. People often second-guess their responses and blame themselves for what they did. Take a moment and answer the question, are you blaming yourself for the trauma at all? And another question, do you think that if you'd done something differently, the experience could have been avoided? Are there people you avoid talking to or things that you avoid doing because of feelings of guilt or shame? Blame can also come from society, friends, family, acquaintances. Take a moment and answer the question, has anyone blamed you for what happened? And also, if so, what did you think about that? Did you think that was unfair, or did you tend to agree with them? Feelings of anger are also perhaps associated with a strong sense of unfairness or injustice. Anger may also be stirred up by the presence of people who in some way remind you of the event. Are you feeling particularly angry or aggressive? And do you have angry outbursts? Is this different from how you felt before the trauma? You'll probably need to pause the presentation at this point to answer those questions. And finally, how does this affect you and other people? Sometimes you may be so angry you want to hit someone or swear. Many people, though, direct anger toward themselves, and these feelings may lead to blame, guilt, helplessness, depression. Now, many people feel anger or irritability toward the people they love the most, family, friends, partners, and children. So take a moment and answer the question, has this happened to you? If you're angry at those who are closest to you, you may feel confused. Closeness might feel good, but it may also seem that it increases the opportunity for being vulnerable and helpless. In terms of self-image, you may be inclined to tell yourself, I'm a bad person and bad things happen to me. Or, if I had not been so weak or stupid, this wouldn't have happened to me. Take a moment and answer the question, are you having any negative thoughts about yourself since the trauma? And what kinds of things do you find yourself saying or thinking? Often traumatic experiences are associated with disruptions in relationships. In order to cope with feeling sad or frightened or angry, you may withdraw from others or stop participating in activities you once did. You may find that people you love the most are not as supportive as you would expect. Has this been a problem for you? Take a moment and answer the question about how your relationships have been affected by this. Have you noticed that you're having trouble getting along with people at all? It's important for you to get the support you need and to recognize that people around you may be going through a crisis too. That means you should be understanding, but it doesn't mean that it isn't worth the effort to make sure that you have people you can talk to who can support you and understand your feelings. It's not unusual to experience a loss of interest in physical affection and sexuality. This might be linked to depression or fear. Take a moment and answer the question, have you experienced a loss of interest in sex as a result of the traumatic events? And have you experienced any frightening thoughts or flashbacks during intimate physical contact? Memories. Because of the trauma, you may be reminded of past experiences. This bad experience can lead to thinking about other bad experiences in your life. That's the way memory works. We tend to think of things that are similar to what we were just thinking about, and particularly things that are tied by a common emotional tone. You may then revisit negative thoughts and feelings about the past that you thought you'd gotten over. You may have trouble thinking of anything positive or that you'll ever be happy again. But you will. As you get past the trauma, you'll start to think of positive experiences again, and that, of course, will lead to more positive thoughts. And finally, some people increase their use of alcohol or other substances. If your use of alcohol or drugs has increased as a result of the trauma, it can slow down your recovery and cause problems of its own. And take a moment now and answer the question, have you been drinking or using substances? And has this increased since the trauma? You might need to pause this to really answer that question. Are there times you tend to do this more? Finally, we reviewed some of the many ways people can respond to trauma. These reactions involve avoiding thoughts, feelings, places, memories, or re-experiencing vividly thoughts, feelings, and memories. Numbness, depression, and detachment, or being easily activated into fear or anger reactions. All of these reactions are common, and all of them improve with treatment. Thank you very much for taking the time to listen. Let me know if you have any comments or thoughts about the presentation. My email address, peter@gatewaypsychiatric.com.